As you all know, ChatGPT, AI, everything has made a man's life easier and challenging equally. So, doctor, what's the role of robotics in neurosurgery?
So AI, ML.
Job made easy?
Yes, so definitely, as you said, it has definitely made our jobs easier, but at the same time, there is a learning curve attached to it.
So, do you think the recovery of the patient who's undergone a robotic surgery, like, is there any better prognosis and quicker prognosis compared to the manual surgeries?
సో రోబోటిక్ సర్జరీ అనగానే చాలామంది అనుకునేది ద రోబోట్ పర్ఫార్మ్స్ అనేది.
Yeah.
So it is the doctor performing the surgery, but in like especially in neuro and spine, so the robots are an aid to the surgeons. So how do they aid us in performing surgeries? So it's definitely helps in better recovery and faster recovery, because we reach out to places where we cannot, which is not humanly possible. But then with the help of the robo, we'll be able to reach out in extreme angles and stuff like that, which makes our job easier, and also make keep the incision smaller, the healing better, recovery faster.
So, are there any risk factors to be considered in robotic neurosurgery?
No.
Not at all.
No.
So, you think that people can go blindly trusting the robotic neurosurgical procedures?
So as I told you again, so it is not the the robo performing.
But it sounds so appealing that, okay, robotic neurosurgery. So, people assume that, okay, robot's
Right.
going to do the surgery and there's no role of a doctor in it.
No, definitely not. So it's the surgeon performing and the robot aiding the doctor. So I'll give you few examples of the robotic neurosurgery which is in place right now in India. So the brain surgeries, ఇప్పుడు there's a deep seated small lesion, which is a very small lesion, say, and not you cannot directly go into the lesion blindly. So imagine a football and a small stone at any point inside the football, and you need to reach out to the stone without opening it up. How difficult it is. So it's difficult. So with the help of the robo and the imaging, so with just help of a small needle, we can directly hit the stone. So that way it makes our job easier and achieve the result with minimal incision.
Can lasers, are lasers in coordination with the robotic surgical procedures or?
Yes, see, you can attach. So the robo is basically a handle to which we can attach a number of instruments. Laser is one of them.
Okay.
RF is one of them, like the radio frequency.
Radio frequencies, yeah.
Yes, and radiation is one of them. Ultrasound probe is one of them.
Okay.
At the same time, the biopsy needle is one of them. So you can use the handle with all these instruments and plan the treatment accordingly.
Fine. It's so soothing to know about the role. To know more about the robotic neurosurgeries and all. So, how far it is helpful in spine surgeries?
The same way in spine. So especially in deformity corrections, so wherein the spine is cross. In correction of these spines, so we take the help of a robo and a navigation system.
Okay.
So wherein we can insert the screws with ease and precision. So the basic help or the main help from the robo comes in precision and decreasing the time. So cutting down the time of the whole surgery. So wherein you can have a better recovery to the patient and with less injuries.
What's the future of this robotic neurosurgery? Are they in trend and taking a lead role?
So definitely yes. So in every field you see artificial intelligence, machine learning, robots. So definitely they do have a role in neurosurgery as well, and I can see a lot of neurosurgical procedures taking the help of these robots, like helping us doctors, to give a better result and with more precision and better outcome to the patients.
So, in the current situation, like, can you just give us a count about the percentage of surgeries being under robotic guidance? And
So
because
now,
not every hospital is
yes,
like stick
equipped with
to
a
equipped with a robotic.
robo. So yeah, there are not all surgeries are dependent on the robo. It is just maybe say a few, like extreme spine surgeries, like complex spine surgeries. And it's not that doctor cannot perform these surgeries without a robo.
Okay.
So definitely, see, we have been doing them, and they'll be done without the robo also. It's just
Obviously,
that,
considering the benefits.
yes. So it is just that better precision and better results with the robo.
So, I guess we got to know a little more about robotic neurosurgeries. Thank you so much, Dr. Anand.
Thank you.